Are you a mid-career researcher who's thinking of expanding your research program into new spaces but wants to test out your ideas first? Or perhaps you're somebody who is going to be putting in a grant application in the next year and wants to develop preliminary data to support that grant proposal. Or are you a new researcher or advising new researchers who have an idea of what they want to study but aren't exactly sure of how to approach that? I will be broadly overviewing hypothesis testing using the NIH All of Us database. My name is Dr. Shauna Beasy, and I'm a assistant professor at Washington State University. But more importantly, I'm faculty member of the Environmental Health Research Institute for Nurse and Clinician Scientists. And my partner, Dr. Kamal Elderwai, and I will be presenting secondary data analysis, where we will be walking you through a 90-minute hands-on session of how to kickstart your secondary data analysis inquiry. That will include helping you develop a research question and getting hands-on experience with both the All of Us database, which I will be speaking to, or NHANES database, which is his expertise, and leaving with a sense of which variables of interest you will be using and the data source of which you will be getting your data from. And so we hope that you join us this summer. So what is the NIH All of Us research program, which I call the All of Us database? It is a bold new vision that was articulated in 2015 from the National Institutes of Health to develop the most comprehensive and the most diverse database of which precision medicine studies could take place in. Barack Obama actually talked quite a bit about it in his 2015 State of the Union address. The goal being 1 million participants with their individualized data inside the database for researchers to utilize, but also for the participants themselves to participate in a partnership with the database. And if you go through the training, you'll hear a lot more about that, about data sovereignty and really being able to direct where your data goes and how it is used in research. To date, they have almost 700,000 participants. And like I said, the goal has really been to represent the previously unrepresented in biomedical research. Over 50% have racial and ethnic minorities. There is a disproportionately female data representation inside of All of Us, and including there are geographic areas of underrepresentation that are now being oversampled, areas such as rural areas. And then it's also a longitudinal database in which people continually provide their data even as they go through pregnancy or become disabled or are disabled. And so it provides a truly unique perspective that was previously just inaccessible at scale to researchers. So what kind of data is inside the NIH All of Us? Well, every single participant participates in the basic survey, which is a lot of foundational health questions, and then their physical measurements. So blood pressure, heart rate, height, weight, things of that nature. And then beyond that, the participant themselves gets to decide how much or how little of their data they're going to share. Some people have generously given access to their entire electronic health records, or participated in specialized surveys, things like the overall health survey, lifestyle survey, healthcare utilization and access survey, and then also family medical history survey. I specialize in the social determinants of health survey, which utilizes not a ton, but more than a handful of validated tools that look at socio-environmental factors at the neighborhood and community level. Things such as the social cohesion scale, Ross-Morawski's physical disorder scale, the perceived stress scale, Cohen's perceived stress scale. As a stress researcher, that has been an invaluable data source for me, the social determinants of health. They also have the PAINS, IPS, looking at the International Prevalence Study, looking at how neighborhood factors influence physical activity levels of the individual, and also food security, looking at the Children's Watch scale. And so there's just a ton of that socio ecological, environmental perspective inside that database. They also collect another one of my areas, biomarkers. So looking at actual lab tests, biosamples, bioassays. Specifically for me, look at allostatic load, which there is a viable way to look at allostatic load inside of the All of Us database, but their neuroendocrine things like norepinephrine, epinephrine levels are at very small sample size, like 1,000. And so there are alternative ways. And in fact, I'm currently in final stages of publishing an article describing those ways of how you could use All of Us to study allostatic load. And then there's mobile health data in there. And what do I mean by mobile health data? Over 15,000 people have generously provided access to their Fitbit data all the way back to 2009. As you can see, as the years get closer to our more recent year, to 2024, the numbers go up of the sample size. But some people's data have been back there. Some people who have given access to their data all the way back to 2009. That is a unique longitudinal perspective that you would be hard pressed to find anywhere else, is seeing the numbers at that level, current state, over 15,000 of time series or longitudinal data of individual health metrics. And so that's an exciting space. I personally have not done much work yet with the wearable device data, but I'm always open to the right collaborator and exploring that with people. Now, the database, it is extremely new. All of Us is extremely new. Like I said, the vision was just cast in 2015, and here we are less than a decade later, utilizing the actual tool itself. And so there are some limitations. When I was granted my workbench in October of 2022, the only way to study or to conduct analysis was through Jupyter Notebooks using either R programming language or Python programming language. I will say, as a big boost to All of Us, they are extremely responsive to researcher feedback. So people pushed back on that, and then they brought in our studios, our studio platform that integrates with the All of Us workbench, so people can now conduct it using R, but with our studio, not using base R in Jupyter Notebooks. And then also they have also brought in SAS as a programming language. I have been told that there is multiple goals to incorporate other familiar platforms into the All of Us workbenches so that it's accessible to more researchers. But because of that, and because of like I said, some of the sample sizes that are in there, it does have some limitations of what you can study, but I think it is an exquisite data source for hypothesis testing. And hypothesis testing, you may recall in your statistics program, is just merely looking at, is there a statistically significant group difference between this group and this group? So I'm talking about t-tests or non-parametric group difference tests like the Mann-Whitney use. I often use chi-square as my hypothesis testing because I do use so much socio-environmental data, and those tend to be categorical or ordinal data sets, and so or even dichotomized. So I tend to use chi-square. But basically, you're asking a simple question and seeing, is there a statistical difference here? And then building off of your answer, then you can refine and add complexity to your analysis. This is particularly important for students and new researchers. I have 4 honor students this year, and I sometimes hurt for the honor students or the new PhD students because they're being asked to design very complex studies without any historical perspective about what they're trying to study. And so, yes, literature review is important, but also is building your next decision off of data, what the actual data says. And so I have been teaching my honor students that the hypothesis testing in all of us, coupled with your literature review, can really kickstart a robust and very intelligently designed research program. So while they all started out with a very simple hypothesis test, they're now off into all other kinds of research, building off of both the literature and the data that they received in all of us. And we'll be talking about that at the workshop session. In closing, I just want to give a little bit cast on the horizon of what is to come in all of us. I was recently invited, like I said, I've been a researcher inside of all of us since October 2022, so about a year and a half ago, a little over a year and a half ago, and I was invited by AACN to give an update of the research that I was doing and how I was utilizing the database. Another presenter at that same session shared something that I thought was extremely remarkable. They were a market coordinator, and they said in April of 2024, congratulations, all of us. You just crossed the benchmark of the 10,000th researcher workbench being established in the NIH All of Us research program. Well, I had been using the database for almost a year and a half. It was stunning to me to think that I was part of the first 10,000 people to ever have used this database through the workbench. And so I'm going to invite you to really consider, is this database right for you? Because you have an opportunity to be early adopter, get new perspective and data that many people have not yet had a chance to try and study. You have a unique opportunity to evaluate the data for NIH. And that's something I've done. I've written two that have been, one that has been published, two that are in the queue, that evaluating, is all of us, where does it situate itself in being able to study this phenomenon? Our one looking at, is it an effective database as yet to study rurality, was just published in the Journal of Rural Health. And so there's a real unique opportunity here. And if that wasn't enough, I want to give you one more peek of the future of all of us. In August of 2023, the National Institute of Environmental Health Sciences announced that they plan on incorporating at-scale environmental data into the All of Us database. So in addition to being able to look at individual lab and wearable data and physical examination data and seeing how that situates itself in already the survey data that looks at socioecological or social environmental neighborhood and community level, we will now be able to, in the future, date unspecified, but I think it will be 4 years from what I'm hearing, look at how is that influenced by air quality, soil quality, water quality, true at-scale environmental data. So the time is ripe, I think, for environmental researchers to really stake their claim in this particular data source and make it clear that it's not just for the genomicists, it's also for us, the environmental health researchers. And I hope to see you this Saturday or this summer at our workshop, Secondary Data Analysis.
Welcome to this session on publicly available data and related issues. In this session, we will define what we mean by publicly available data and discuss sources of publicly available data and advantages and challenges, as well as issues to consider when using publicly available data. What do we mean by publicly available data? What we mean is basically data that are available to be used by the general public. However, the accessibility of the data could vary. For example, you might have data that are just publicly available for researchers. You go online, find the data set you want, and you download it. An example would be most enhanced data, data from the National Health Interview Survey, and so forth. Now, there are some data that are available However, you need to go through a special procedure. For example, in Enhance, you have restricted data that you could potentially access, but you need to go through a special procedure, especially when you are looking for some identifiers such as the zip code. Now, there are other data that are available for faculty and researchers at certain institutions. For example, the Inter-University Consortium for Political and Social Research. It's a consortium of over 750 members, and if your institution is a member of the consortium, you will have an access to a wide variety of data sets, thousands of data sets. Let's spend some time discussing the advantages of using publicly available data and for that matter, data that could be accessed, whether it's publicly available or through a special procedure, it's still available. Usually, these kinds of data are of high quality and they are mostly readily available. You might need to do some data manipulation to get to the data set you want, but they are readily available. And often those data are national data, representative, using representative samples. So you can make inferences and you can generalize to the larger United States population, or for some data sets to the state's population. So basically you will have access to representative samples, whether representing the state or representing the country. And some of these data sets have an extensive list of variables, and variables that you can search. You can decide what variables you want, and for the most part, you don't have to do data cleaning. You need to do data management, and once you decide on the variables you want and the data set you want, you might need to do some merging and linking to get to the data set you want and you need to use to address the research questions you're planning to address. Some of these data sets collect data over cycles, and those data can be used to assess trends over time, and some of them actually are from the same individuals that are collected at multiple points in time, and that will allow you to conduct longitudinal research. Not only that, some of these data sources could be linked with other sources of data, such as the census data, the vital statistics data, and to examine, for example, the relationships between some exposures and mortality, and the Enhance have the linked data set, and I included some description and some information on the linked Enhance data set in another section, but you will have access to that information. Some of these data sets might include biomarkers data. In fact, some of these programs have biospecimens you can, through a special procedure, apply to get access to for research projects. You could apply for a grant to use those biospecimens for, to examine original research questions, including here the biospecimens, the Enhanced Biospecimen Program, or the NHLBI BioLink repository, and those you need to go through a special procedure, and you need to submit an application to have access to the biospecimens. Now, there are some challenges to using existing data. First, you want to make sure you read the documentation. You want to read the manuals, and some of them have very long manuals, and some of those manuals could be very technical. So you want to go through all of these manuals, go through the documentation. You need to understand how the study was conducted, how the sample was selected, how the data were collected, and obviously that takes time, but that's very important because you need to understand how data were collected and what variables, what questions were asked, how they were asked, and the sample that was used, what age group that they targeted, and so forth. So if the data were collected over different cycles or multiple cycles, sometimes the questions might not be consistent over time, and you might have the question asked in a given year but not in the following year. So you need to do some search to make sure that you have enough data over a number of cycles to be able to have enough sample size to address your research question. Obviously, since you as the researcher did not collect the data, you did not design the study, you have lack of control over the data or the biospecimen collection. So you want to basically live with what you have. So you might not find all the variables you want. You might find a select variable. So for example, if you're interested in all types of smoking, you might not find all types of smoking. You might find cigarette smoking, for example. You might find vaping. You might not find other types you might be interested in. By the same token, data on important covariates you want to control for might not be collected. And again, if data are not collected in a consistent manner every year, and the questions were not asked to the entire population every year, you might find some data missing. Missing because questions were not asked, but also you might find it missing because people did not answer. So you need to find ways to deal with missing data. These data sets usually require a lot of data manipulation. Sometimes you need to do linkage to link data from multiple sources, and you might need to merge, and that needs time and expertise. And these kind of data, especially when they are representative data, require complex analyses that need certain expertise. Here are general issues to think about when using existing data. You first need to know the source of the data, how data were collected. You need to read the manual or manuals and documentations very carefully. It helps if you can see examples in the literature related to your area of research, what kind of questions were answered using the data source you are interested in. We understand the data collection process, the frequency of data collection, the sample, what age groups and the procedures and so forth. And you want to determine, obviously, if the source is appropriate for the research questions you are interested in. Now you want to learn about the missing values, how many are missing, how those are handled. You might need to do special procedures to address the missingness in your sample, and you want to identify the analysis weights and think about generalizability and to which population you can generalize your findings. And dealing with existing data often requires having a statistician, having somebody with the expertise needed to merge, to identify the data set you want, to manipulate the data so it's ready for analysis, and to analyze it if you don't have that expertise. This is just a brief list of publicly available data. Included in the section is a longer list of 12 or 13 sources with links you can click on and learn more about those data sources. Thank you.